Welcome to the USDA Rural webinar. We're glad you can join us today. This meeting is being recorded. To access closed captioning, use the link provided in your chat box. It will open in a new window. To submit questions, you may use the question/chat panel throughout the presentation. All questions will be documented. A copy of today's presentation is available as a handout. You may download it to your own computer at any time. To get us started, I'd like to turn the time over to Farah Ahmad, USDA Rural Development's Chief of Staff. Farah.
Thank you so much. It's a pleasure to be here, and welcome to all of you, and thank you for joining today's webinar. I'm really thrilled to be a part of this announcement about the Emergency Rural Healthcare Grant Program. As I think many of you know, the Biden-Harris administration's historic emergency legislative package, the American Rescue Plan, is really changing the course of the COVID-19 pandemic, bringing relief to millions of households and building a bridge towards economic recovery, including in rural communities. And the administration is taking action to improve the health of rural people and places by making millions of dollars available through the American Rescue Plan for that relief. And part of that was the Emergency Rural Healthcare Grant Program. Secretary Vilsack actually announced this a week before last, and it's $500 million in grants, really to help rural healthcare facilities, tribes, communities in their efforts to expand access to COVID-19 vaccines, critical healthcare services, and even nutrition assistance. What's really wonderful about this funding is that it expands rural hospitals and providers' access to a variety of different tools, whether it's helping healthcare providers stay financially solvent in the long term, or much needed short-term assistance regarding testing or supplies. And we're thrilled at USDA Rural Development to be in the place to administer this program. USDA Rural Development, we're in a unique position to support communities in rural America and help them thrive as they go through their efforts to recover from the COVID-19 pandemic. And that's why we're administering this program through Rural Development and through its Community Facilities Program. You're going to hear a little bit more from the team today about how these grants will be administered. And you'll hear about two different kinds of funding tracks. One really geared towards recovery, which I just spoke about, and another track of grants that's really geared towards a long-term impact, as we know that rural healthcare facilities are really critical, both to providing needed services, but also as an economic driver in rural places. And so we really are excited about this second track, which are called the impact grants, which really focus on some long-term sustainability support. And so with that, I just want to say thank you again for taking the time to learn more about this program and for working with USDA Rural Development. We're excited about this, excited to partner with all of you to bring this much needed assistance to rural communities. And I will hand it over to our Acting Administrator for Rural Housing Service, Chad Parker.
Thank you, Farah. I think I first will jump into a little bit about who Rural Development is and talk some about our Community Facilities Program, and then we'll get into some details on the Emergency Rural Healthcare Grants. So yes, next slide. I think it came up. Looks white to me. Can you see the slide?
Yes, I apologize. We're experiencing some bandwidth issues, but it will pull up shortly.
Okay. So I'll go ahead and talk about this slide as it comes to us in a second or two. Rural Development is a mission area inside of USDA. It offers more than 40 loans, grants, and technical assistance programs to support economic development across USDA's rural communities. Rural Development supports essential services such as housing, economic development, healthcare, education, water infrastructure, electric and broadband infrastructure. Rural development invests more than $28 billion each year, and our total portfolio consists of $250 billion in assets. So should I wait on the slides?
Why don't you keep going? The handout still works. My apologies, but I will have them up momentarily.
Okay. Everybody can do that if you can. Feel free to switch to the handouts and follow along there. So on the next slide, most of our 40 programs, including the emergency rural healthcare grants and our community facilities programs, are delivered through our network of 47 rural development state offices and 400 area offices located in rural communities throughout the country. Each of those rural development state offices are overseen by a state director. So as you learn more about our programs today, if you think you're interested in applying, then I recommend that you reach out to that rural development state office, make a connection with your state director and your community programs director. Those are the people that are going to be able to assist you as you consider this opportunity. So next slide. I'm going to run a little bit tell you a little bit about the community facilities program. Before we get started talking about the emergency rural healthcare program, because the community facilities is kind of our umbrella that the emergency rural healthcare program sits in. Our community facilities program provides loans, grants, and loan guarantees to develop or improve essential public services and facilities in rural communities with populations of 20,000 or less. Our community facilities program can fund more than 100 different types of essential community facilities. The largest portion of that is healthcare. About 50% of our portfolio is in healthcare facilities. The vast majority of the funding we receive each year is for direct loan funds. Right now, we get more than $2 billion in loan funding each year for the community facilities program. We get about $500 million in community facilities guaranteed loans. And we get about $30 million each year in community facilities grant funding. So next slide.
I think, Chad, let's pause a second. Jamie, there's some background noise.
Should be good now, I think.
Yeah.
Right? Can we
you're
try
good.
the
Go
next
ahead.
slide? Yep. There we go. So our emergency rural healthcare grant program, like I said, we get about $30 million each year in community facility grants. We're getting a very significant injection of funds to help out in rural healthcare across the country. $500 million is being provided under the American Rescue Plan Act for the emergency rural healthcare grants. It's specific to providing healthcare and nutritional assistance. This is an enormous increase compared to our regular grant funding, and it's going to allow us to help many distressed and vulnerable communities. One of the priorities behind this funding was the vulnerability of our rural healthcare system. In 2020, more rural hospitals and clinics closed than in any previous year, reasons that go far beyond just the COVID-19 pandemic. At a time when we desperately need availability of healthcare, too many rural hospitals and rural clinics are struggling to stay open. The Emergency Rural Healthcare Program offers 2 tracks of funding that are designed to help keep our rural healthcare facilities entities prosperous and available to our rural citizens. So under track 1, what we refer to as recovery grants, we're providing grants ranging from $25,000 to $1 million to support immediate rural healthcare and nutritional assistance needs as a result of the pandemic. Through this track, rural development can support purposes such as cold storage for vaccines, medical supplies and PPE, telehealth, construction and renovation of healthcare facilities, lost healthcare revenues, staffing for vaccines and testing, and support for food banks and food distribution facilities. We understand that current healthcare needs vary widely. A small rural health clinic may need equipment such as a freezer for vaccine storage. Other facilities, like rural hospitals, may need a much larger renovation for better patient flow or HVAC upgrades or isolation rooms. That's why you see, I think, that big differential between the $25,000 minimum and the $1 million maximum on Track 1 grants. For Track 2, we refer to them as impact grants. They're going to provide grants ranging from $5 million to $10 million for regional consortiums or networks of entities who work together to solve specific regional healthcare issues and to support the long-term sustainability of rural healthcare. USDA wants to help establish models that will improve rural health outcomes, increase the availability of healthcare services, and to ensure that the local hospital or clinic remains viable as a community and economic driver. Next slide, please. The application deadline differs a little bit between Track 1 and Track 2. In both cases, our first recommendation is for the applicant to reach out and work with your local rural development state office, state director, and community programs director. Once you've completed an application for funding, you will work directly with your state office to make sure that application gets submitted appropriately. For Track 1 applications, we will continue to accept applications until funds are no longer available. But our state offices, they're going to take in all of the complete applications that they've received, and on October 12th at 4 p.m., they'll take those applications, everything that's in and complete at that time, and conduct an initial review, rating, and ranking of those applications. For the Track 1 recovery grants, they'll continue to accept applications after October 12th until they no longer have funding available in the program. For Track 2 applications, those applications are also due by October 12th, but they're not going to be accepted after that date. So the open period between now and October 12th is the only opportunity to apply for a Track 2 award. We'll be periodically pausing to answer questions as we go through these slides, but we're probably not going to be able to address everything that we receive. During our previous webinar, I think we got around 400 questions, and we maybe answered 50 or 75. We're working on a frequently asked question document that we're going to post up on the program's webpage. I think we've already finished our first tranche of those questions, and they're getting put up on the webpage in the very near future. So if we don't get to all your questions today, we invite you to continue to look at our website, and we will make sure that we respond to each and every question that comes up. I'm going to stay on for the question and answer sessions. But right now, I think we'll turn it over to Jamie and let her run through the program details. Jamie?
All right, thanks, Chad. So we're going to start by discussing the program eligibility. If we go to the next slide, Jamie. Like in our regular community facility programs, eligible applicants under this new emergency rural health care program include public bodies, nonprofits, and federally recognized tribes. These organization types, these eligible entities, are the same regardless of which track of funding that you might be requesting. For public bodies, these can include municipalities, counties, districts, or authorities. For example, county-owned healthcare facilities may be eligible, or local healthcare districts. State public bodies, however, are not eligible. And we've had some questions from state public universities. Public universities are not an eligible applicant. However, there may be an opportunity for public universities to participate in our Track 2 impact funding, which we'll cover a little bit later. We've received a lot of questions already asking whether certain types of organizations are eligible for this funding. Can an assisted living facility apply? Can an entity providing EMS services or a doctor or dentist office? Can a community center apply that's operating a food pantry? And first and foremost, our answer is that applicants must be organized as a public body, a tribe, or a nonprofit. And you'll see that the use of funds is specific for this grant to healthcare services and nutritional assistance. So to the extent that your organization is a public body, a nonprofit, or a tribe, and provides some type of healthcare services or nutritional services, then you have an eligible type of organization. The applicant entity does not have to be solely or majority focused on providing healthcare services or nutritional assistance. I also want to point out that nonprofit applicants to our program have an additional requirement to demonstrate significant ties with the local community. And this is to ensure that the nonprofit carries out a public purpose and that it will continue to primarily serve rural areas. And demonstrating significant ties to the local community, it can be a nonprofit that is closely associated or controlled by a local unit of government. It could be demonstrated through a nonprofit's board of directors, a board of directors with appropriate expertise, and a board of directors that is located in and representative of the community or service area. Or it could be that the nonprofit receives specific taxes pledged to benefit the nonprofit. So these are all requirements, eligibility requirements for the applicant entity, whether you are applying for Track 1 or Track 2. And there's some additional eligibility guidelines for Track 2 applicants, which we'll discuss in that part of today's presentation. So now I want to jump into rural areas. So that was the applicant type of entity. And next we're going to talk about what rural areas. So on the next slide, after you've determined whether an entity is eligible as a public body, as a nonprofit, or a tribe, then you need to consider the rural area of your project or facility. And there are two components to determining what rural areas are eligible for this program, and that includes looking at population and income. For population, facilities must be located in and must primarily serve rural areas with no more than 20,000 population based on the 2020 decennial census. So this means cities, towns, and census designated places that have populations of 20,000 or less. Primarily served. That means at least the majority of the population within an applicant service area must be located in eligible rural areas. So again, those cities and towns of 20,000 or less. As for the decennial census, we're operating off of the, I have a mistake on my slide, I see. We are operating off of the 2010 census. So while some high-level information on the 2020 census came out recently, the localized data that we need for this program is not yet available. So we're continuing to operate based on the 2010 census, and I'm going to have to fix that on the slide. So as for income, now I want to touch on income. In addition to the population requirements of where the facility is located, we also have to look at the median household income of the population to be served by the facility. And that MHI, median household income, must be less than either the poverty line or 90% of the statewide non-metropolitan median household income. For the MHI data, we use the 2010 5-year American Community Survey. And I know we have a lot of questions regarding the data source, both for population and for MHI. So we're going to put links to those respective data tables from census in our frequently asked questions, which are going on the web, as well as we have on a slide coming up. We also have the links to those tables. So the amount of the grant that we can provide under this program depends on the population and of where the facility is located and the MHI of the service area for that facility. Smaller communities with the lowest MHI are eligible for a higher proportion of grant funds. And if we go to the next screen, we'll talk about the maximum percentage of grant that we can cover under this program. So in this program, like our regular CF grants, we can fund up to 15 or 75% of total project costs. And that applies whether we're talking about track 1 or track 2. These same percentage limitations apply to both tracks. And applicants must provide other sources of funds for the remaining project costs. In the first bullet here for 75%, a project that is located in a rural community with a population of 5,000 or less and serving a population with MHI that is less than the poverty line or less than 60% of the state non-metro median household income, that project is eligible for a grant of up to 75% of the total project cost. So the applicant must still raise or identify other funding sources for the remaining 25% of project costs. On our webpage, on both the track 1 and track 2 pages that are on our webpage, we include links at the bottom of those pages for application guides. And both of those guides include an example of how we determine the maximum percentage of grant that an applicant qualifies for. So I encourage you to take a look at those application guides to look at the example to help you determine which of these buckets that your particular application might be eligible for. And importantly, to reach out to our local rural development state offices to help you with those questions as well. All right, so if we go to the next slide, I think we want to pause here for a second to address some questions that we've already received on eligibility before we talk more about the use of funds. And Chad, I did tee up a couple questions here we'll go through first, and then we can look at the question box. But if we go to the next slide, by far the one of the most common questions that we get is, what do we mean by rural? What is the rural definition for this program? So this is what will be in our frequently asked questions. So what do we mean by rural? Rural is a facility or project. It must be located in a city or town of 20,000 or fewer people or in an unincorporated area. We aren't looking at population by census tract or by the whole of a county. It's based on the population in a city or town, or if not in a city or town, then in an unincorporated area. Also, for rural, the project must also, to meet our rural definition, the project must also primarily serve rural residents in cities or towns with a population of 20,000 or less. So the service area can be greater than 20,000, but a majority of the population that a facility serves must live in cities or towns of 20,000 or fewer people. So I hope that helps answer some of those questions that we've gotten in. On the next slide too, if we go to that, these are the questions and answers in the frequently asked questions around the data sources. So, so where can you find the population data, and where can you find the MHI data? These links here go to the relevant tables on the census website. So you can click right on those and then identify your city or town that you're looking for and find that data that you need. Chad, do we have some questions from the chat box?
Yep. Oh, we've got tons of questions. I think I am going to comment on the median household income. Just so everybody knows, what we ask is for the applicants to tell us the service territory of their facility, and then USDA Rural Development will go in and make that determination of median household income. We're not asking the applicant to go in and to make that calculation. We're providing you information on where we're pulling that data from. So I guess I'll jump into the questions. We've got a whole bunch of them here. First question is, does each state receive a specific allocation to award grants to organization in its state? So we are allocating for track 1, $300 million of the funds will be allocated out to the rural development state offices. There's a formula that we use to do those allocations based upon the rural population of that state and the median household income of the rural population of that state. So each state gets an allocation. The states that have larger rural populations and lower median household incomes of those populations receives more grant funds. How is population determined for unincorporated areas that are not included as census designated places? So if you're in an unincorporated area that is not part of a census designated place or CDP, then that is an eligible rural area for us to have a facility located in. But as Jamie spoke to earlier, there are multiple pieces of the rural definition, and an applicant has to meet each of those items. Next question. Good afternoon. Are public school districts able to apply for this grant? To the extent that the school district has the legal authority to apply within their state, and that they are typically a public body would typically be able to apply for funding. But I think you've got to have your school district look at its organizational documents and ensure that it is able to apply for funding. But there's no restriction inside of our program. Two-part question. Could a Track 2 application be submitted by a lead applicant, mostly in one state with various rural sites, but also include a rural partner site in a neighboring state? So yes, if you're a Track 2 application and you're applying, you could have consortium partners located in multiple states. And then if allowable, would the application be submitted to the state USDA office in the lead applicant state? Yes, so wherever the lead applicant is located, that is the state office that you will work with on your application. Next question. Do community facilities include skilled nursing facilities and assisted living facilities? Yes, those would be typically facilities that provide some type of healthcare activities. They could apply for Track 1 grants to the extent that they're providing healthcare related to the COVID-19 pandemic, and they want to ask for assistance in one of those eligible uses under the eligible use of funds. In those types of facilities, if they are a nonprofit or public body, then they could apply. Has the webinar begun? Huh, that's not one we have. Yes, it has. Can you clarify? USDA defines a rural community as far as population size. As Jamie mentioned earlier, it's the city limits of a city or town. It has to be less, or CDP has to be less than 20,000 in population. We are a small member rural health system. Each member hospital has a separate EIN and local board. Could the consortium for Track 2 be comprised of 3+ member hospitals? So if you're each a separate member hospital, nonprofit or public body, you each have a separate tax identification number, employer identification number, and a separate local board. It sounds like you're separate entities, not a wholly owned subsidiary of the system. It sounds like you're affiliate organizations. And in that case, yes, you would be able to have each of those members act as a separate consortium member for a Track 2 application. Let's see. How do you view multiple proposals from one entity, even if they are distinct? How do you view multiple proposals from one entity, even if they are distinct? I'm not sure I understand what they're they're looking for there? Jamie, any ideas?
No, I'm sorry.
I think maybe submit your question again and give us a few more details. Next question, would a food hub count as a community facility? So a nonprofit or public body food hub or food distribution facility that was engaged in providing food due to the pandemic would certainly be an eligible entity that would be able to apply for Track 1 funding. Next question is, does home health and hospice agencies qualify for these grants? Yes, a nonprofit home health hospice agency, or if there's one maybe associated with a public body, they could apply and say for staffing expenses that had to be increased due to the COVID-19, directly related to the COVID-19 pandemic and provision of healthcare during that time frame. If they had increasing expenses, they could apply, increased staffing costs, or say if they lost revenues, were unable to go out and perform the activities, healthcare activities, like they had been doing previous to the pandemic. I think both of those would be eligible opportunities under the emergency rural healthcare grants. Jamie, do you want to comment on that?
No, I wanted to move on to the use of funds, and then we can come back for more questions.
Okay.
Okay. All right, let's go to the next slide. We'll periodically keep pausing and taking some questions. Okay, so we want to start talking about the use of funds now for the grants. So eligible entities, eligible rural areas, and the maximum percentage of grant are the same, regardless of whether an applicant is applying for Track 1 or Track 2. But now we'll talk about how the use of funds differs between those two tracks. So for all grants, for both tracks, the funds must be used to support healthcare or nutritional assistance in relation to the pandemic. For Track 1, the recovery grants, they range, as Chad mentioned earlier, from a minimum award size of $25,000 to a maximum award size of $1 million. And these grants are meant to provide immediate relief to support healthcare and nutritional efforts stemming from the pandemic. We expect that we expect to get a lot of interest and demand for these Track 1 recovery applications from applicants. The Track 2 impact grants are much larger, $5 to $10 million, and these are meant to advance ideas and solutions to solve regional healthcare problems and to support the long-term sustainability of rural healthcare. So what are some ways to improve rural health outcomes? What are some ways to ensure that rural areas maintain access to healthcare? We're going to first talk about the use of funds for the Track 1 recovery grant. So go to the next slide. And one more. Okay, so on this next slide, we have the full list of eligible uses for the Track 1 recovery grants. As we mentioned, the funds must be used in relation to the pandemic. Requests can be based on an immediate COVID-related healthcare need. It could be to help prepare for a future pandemic event or to increase access to healthcare services. The eligible use of funds here are designed to be quite broad, to be flexible, to meet the needs that differ from community to community, and to meet the needs that we've heard so much about as we were developing or designing this program. I do want to note too that, as with other federal programs, any funds that are requested here under this grant cannot duplicate any other grant funding that you may have received from other federal or state sources. So to the extent that other grant funding that you may have received, maybe from other COVID relief funding that has been offered, To the extent that that other grant funding didn't fully meet the need of your facility, then those requests may be eligible here under this program. So if we look at each of these specific use of funds, the first is to increase capacity for vaccine distribution. So we're thinking of things like freezer and refrigeration units, the cold storage needs for the vaccines, vehicle, transportation, and other equipment expenses. We've heard of applicants having interest in purchasing mobile units or vans that can travel around the service area to promote and distribute vaccines. So those are just some examples of what might fit into this category here to increase capacity for vaccine distribution. The next item is to provide medical supplies and equipment to increase surge capacity. So certainly thinking about PPE and lab equipment, but it's a huge range here of possible supplies and equipment, as long as those supplies and equipment can relate to the COVID pandemic and maybe the care that you're providing because of the pandemic, or preparing for the potential for a future pandemic. Those can be eligible here. The next item is to reimburse for lost healthcare related revenue, and we're going to talk about that in just a minute on the next slide. The next item is to increase telehealth capabilities. So this program can help support the purchases or expenses that you may have related to electronic health record systems, or purchasing iPads or other equipment to help facilitate telehealth visits. Those can be included here under the telehealth use of funds. The next item is to construct or renovate temporary or permanent structures to provide healthcare services. So it could include renovations to a facility to include automatic doors, so you're not having to touch door handles. It could be upgrading HVAC systems for better airflow and for better infection control. Could be investing in negative air pressure rooms, utilizing UV lights, again, for infection control or room cleaning, adding hand hygiene stations, more touchless sensors for sinks, water fountains, doors. Those are just some examples of some of the renovations that we have heard expressed that can be funded under this program. The statute also does allow for the construction of new facilities too. Again, it's very broad, but it does need to relate back to the pandemic. So to the extent that there's a need for a new facility because of the pandemic. The next item is to support staffing needs for vaccine administration and or testing. The healthcare services staffing is limited to these purposes. The next item is with respect to nutritional assistance. This grant can support facility, equipment, and increase operating expenses associated with food banks and food distribution facilities. Again, this has to be COVID related, so we are looking to fund increased expenses because of the pandemic. The demand has increased at a food bank or a food distribution facility, and here are the increased expenses to be funded through this grant. The next item is that the grant can be used to pay for some professional service fees and charges, but only when necessary and only when it's a secondary part of the grant. And finally, the grant can be used to pay for pre-award costs that were incurred between March 13th, 2020, that was the day the national emergency was declared, and the proposed start date for your award. So we can reimburse for expenses that have been incurred that are eligible under this program. We can reimburse for expenses that were incurred between March 13th, 2020 and the start date for your award. We can go on to the next slide and talk a little bit about lost revenue and construction, and then we will pause for more questions. So we do anticipate that there may be significant interest in reimbursements for lost revenue. And we want to specify or clarify here that the request for lost revenue must be healthcare related. We've gotten a lot of questions around the types of entities that can request lost revenue, particularly for entities that are not strictly healthcare related, like a hospital or a health clinic. So if an entity provides services beyond just healthcare, then the applicant, that entity has to segment out only the healthcare specific revenues. We aren't able to reimburse for lost revenues that are not related to healthcare. The NOFA for this program, it specifies two separate approaches for calculating the amount of lost healthcare revenue that can be requested. The first approach is by comparing the actual revenues. So we can compare actual revenues from 2019 to what was received in 2020 or 2021. That is one way to calculate the amount of lost healthcare revenue. Applicants can choose the time period. So you may decide to request lost revenue from particular months or quarters, and that's fine as long as you similarly compare that time period with the time period from the previous year. So you need to be looking at the same time period across those years. An alternative option, the second option, is that you can calculate lost healthcare revenue by comparing an approved budget to actual revenues. And if you're using this approach, the budget must have been approved before March 13th, 2020, though. Regardless of which option an applicant chooses to calculate the lost revenues, we are requesting that applicants provide a CPA certification as to the calculation of the lost healthcare revenue, as well as confirmation from the CPA that those lost healthcare revenues have not been reimbursed from other sources. And for applicants that may have already received funds to cover lost revenues, whether it was from one of the other relief programs at HHS or other agencies, it doesn't necessarily preclude you from receiving funds under this program, under this category, but the applicant must demonstrate that those funds that they received in other programs did not fully cover the full extent of the lost healthcare revenue. So that is a quick overview of that lost healthcare revenue use of funds for the program. The next slide is on construction or renovation. And this is another category, another use of funds category that we expect to see high demand for construction or renovation of temporary or permanent structures to provide healthcare services. This can be directly related to COVID vaccines, testing, or providing COVID-related care. It can also be renovations and modifications to better prepare a facility for a future pandemic. We included these examples here, these bullets that are on the slide. We included these examples of facilities in the NOFA that provide healthcare services, but this is not meant to be an exhaustive list. These are just some examples and some examples of the facilities that we most typically work with in this sector and that we're often asked about. But certainly this is not the full list of types of entities that can request funds to help support construction and renovation needs of healthcare facilities. A new requirement under this program, the American Rescue Plan does require for this program that any funds used for construction must adhere to the Davis-Bacon wage requirements, which sets minimum wage rates. So that's a new criteria or new requirement for this particular program that doesn't apply in our other community facility programs. We've had some questions, and the NOFA does go over this. We've had questions about whether pre-award costs for construction and renovation, whether those might still be eligible under the program. And yes, you can potentially request funds for construction and renovation expenses incurred during that pre-award period from March 13th, 2020 on. But that construction and renovation must still adhere to all of RD's requirements, including Davis-Bacon. So Davis-Bacon and environmental requirements, as well as rural development's architectural requirements. So that is something to just be aware of. It does make awarding funds for construction and renovation during that pre-award period to be complicated to demonstrate compliance to those requirements. If we go to the next slide. If you're interested in applying for a Track 1 recovery grant, then we encourage you to reach out to your rural development state office as soon as possible to let them know of your interest, to discuss any questions, talk about your service area. Please do reach out to your local state office as quickly as you can. All of the reviews and selections for the Track 1 awards will be made at our state offices. The Notice of Funding Availability, or the NOFA, that we put out that established the program, it outlines the selection criteria that we will be using to prioritize applications for funding. So these particular criteria here, these are all objective criteria, and you can learn about each of them by looking at the NOFA or the application guides that have posted to the web. So now I think we'll pause for questions again, Chad.
Yep, you'll be happy to know we've got a ton of questions. So started off, we've got a couple that I think I want to hit on right to begin with that we've got multiple times. One is asking if we're going to make a recording of this webinar and make it available. Yes, we're going to post it up with a link on the Emergency Rural Healthcare website that's available through USDA. So yes, we're recording this and we'll make this webinar available. Let's go to the next one. Under Track 2, is it allowable to do multiple projects in multiple locations under one application? If you're applying for a Track 2 application, you're applying to solve a regional health problem, laying out activities you're going to do, giving then a way to evaluate that model to show whether or not it solved the regional healthcare problem. So as that list of activities, you could have multiple project activities that are all eligible under the Emergency Rural Healthcare grants going on in different locations. So you can have multiple activities going on at different locations, consortium members at different locations under a single Track 2 application. Is it the case that using any of the grant funds also requires compliance with Davis-Bacon wage scale? So if you're doing any construction, yes, the Davis-Bacon wage scales are required. And it goes on further, is there a way to segregate the grant portion from the larger projects so the Davis-Bacon wage requirements are not required of the total project? No, if the grant funds are a part of a project, then the Davis-Bacon wages is required to pertain to the entire project. Now, you can maybe segregate if you were doing different phases of hospital construction. You could limit your project to a certain phase of the construction and then have that be the project and have the Davis-Bacon wages apply to that phase, as long as it's a complete phase to do a wing or maybe to do the HVAC system renovation. That could be the project. And then later on, you could do other projects that require construction that the Davis-Bacon wages would not apply Who is the decision maker, the state office, or does DC USDA do it all? So we are taking $300 million of the funds and allocating it out for Track 1 grants to each of the rural development state offices. The state offices, area offices, and state offices will receive those applications in, review them, and make those grants from the rural development state offices. So a good portion of the Track 1 grants will have no national office DC involvement. We are holding approximately $50 million in national office reserve funds. So when a state runs out of their Track 1 fund, they can come up and request additional funding from the national office for that portion. The Track 2 grants are going to come into the state offices, but then they will be moved to the national office level, where we will distribute them out to a group of healthcare experts, where they will be reviewed and scored there. And then we'll bring those members together to make sure we come up with a consistent scoring amongst the team for each of the Track 2 applications. So the scoring of the Track 2 will be done more at a national level. Can you apply for Track 1 and Track 2 opportunities? So yes, applicant for a Track 1 grant could also be a consortium member in a Track 2 application. What time zone? What does local time mean? So I assume that they're referring to the 4 p.m. local time as the deadline for the application. That's the time of that rural development state office in your area. So if they're on the East Coast, then it's a Eastern time frame. And as you work through the different time zones, it's the time zone where that rural development state office is located. Does a CPA have to certify applicants' lost revenue prior to the application, or is the certification required prior to the use of funds? So if an applicant is applying for a Track 1 grant for lost revenues, they're going to have to identify what those lost revenues are as a part of the application, and that CPA certification would need to be a part of that application. So they would have to, the CPA would have to certify off on those lost revenues at the time of the application. Do you consider oral health as an eligible health service? So yes, you could have a nonprofit dental clinic that operates in a rural area come in and say that they need to renovate their HVAC system, they need to do renovations in their patient care areas due to the COVID-19 pandemic. So yes, that would be an eligible type application. For further clarification, for Track 1, no funds will be determined prior to 10/12. Is that correct? Yes, we're going to collect all the applications for Track 1 at the rural development state offices, and then they will compete those applications against each other based upon the scores that are laid out in for Track 1 in the notice of funding availability, and then they will all be funded after 10/12. So yes, that's correct. No funds will be determined prior to October 12th. Next question, a lot of questions here. Does the community facility requirement of credit elsewhere also apply to these USDA grant tracks? No, the credit elsewhere provision was not a statutory requirement for the emergency rural healthcare grants, and USDA did not choose to include it in the notice of funding availability, so it does not apply for this grant program. For Track 2, for a program that does not require equipment or building or renovation project and only would require funding for staff, would this application score as well as any that does not focus on new equipment or building and construction projects? So the scoring criteria are laid out in the notice of funding availability. Please review that, and I think you can get a pretty good idea on how an application would score. I don't believe there's a funding priority for construction versus staffing costs built into the scoring. It is more focused on trying to fund applications that areas that are related directly to COVID-19 vaccine and testing, and for those areas that have been impacted by COVID-19. When we do the COVID-19 testing, we send them to a lab for processing. Is this cost covered under Track 1? COVID-19 testing, the lab review of that is an operating expense for a healthcare service. As long as it occurred in a rural area for an eligible rural facility, absolutely, this could be applied for as an eligible cost under the Emergency Rural Healthcare Grants Track 1 applications. Will a grant application packet be made available for each track? So on our grant, on our website for the Emergency Rural Healthcare Grant Program, we do have an application guide is what I would call it for both the Track 1 and Track 2 applications that's up and available right now. I think this would be a very good start for anyone. That and the notice, taking a look at those together would be very helpful. If there is additional information you'd like to see as a packet, please let us know. I think we identify all the forms inside of the grant guide. So I think it's all there. But if there's something missing, please let Jamie and I know about it, and we'll try and make that correction. Next question. We are in North Carolina and do not currently have a state representative. Who should we work with for this opportunity? So on the USDA Rural Development, if you Google USDA Rural Development State Office or USDA Rural Development State Director, you can find who your state director is. And if you Google Rural Development State Offices, there's a listing of state offices, contacts there. You can click on contacts. There is a community program director in every rural development state office and an acting rural development state director that is presently in charge of every rural development state office. So those people are in place. And if you can't find them, certainly reach out to Jamie and I, and we'll also put you in contact with the right people. Next question. Will frequently asked questions from the webinar be shared and available somewhere for participants and interested parties to access? Absolutely, they're going to be up and available on our Emergency Rural Healthcare website. We have to submit those through a group that makes them available on the web. We've already submitted our first tranche of questions from the earlier webinar, and Jamie and I will be spending a lot of time answering all of the questions and making sure they're available. So yes, they're all will go up. Is the 20,000 population limit for the healthcare service area? Nope, the 20,000 population limit relates to where the healthcare facility is located for your Track 1 application. If the clinic is located in a city or town, that city or town has to have a 20,000 population or less. Are you using the 2010 American Community Survey or the 2018 American Community Survey? Last week you mentioned 2018. So we did mention 2018 last week, and that was an incorrect mention, my fault. We are using the 2010 American Community Survey, and we did send out an email to all participants in last week's webinar and letting them know that, and that is included in our frequently asked questions. I think it's our first question on the frequently asked questions. So the answer is 2010 American Community Survey. When determining population, if a rural hospital serves an entire county and wants to apply, would the rural area community population be defined as the population of the actual city the hospital is located, or the population of the entire county? It's the population of the city where the hospital is located. Would a fire company purchasing a new fire engine qualify for Track 1? I know that there are some fire engines that do provide healthcare, the smaller trucks that are almost like a first response vehicle that may be able to go out and provide some type of healthcare service. So I don't want to say no and limit absolutely any fire engine. So that to the extent that they're providing healthcare services and you can directly relate that healthcare service to the COVID-19 pandemic, that might be a possibility. For a standard fire truck, pumper truck, or a fire engine ladder truck, no, I don't think that you would be able to make those as eligible expenses under these grants. Let's go to the next question.
Maybe let's just take one more, Chad, and then we'll keep moving.
Okay, does the matching funds need to be handed in hand to be considered? Raising substantial funds by October 12th would be difficult for poor rural areas. So I don't think that they have to have those in hand at the time of application. Is that how we wrote? Do you recall how we wrote the notice? That would be the way I would assume that we wrote the notice. We'll respond back and put that in our frequently asked question document. It's a good question. I'm not 100% sure. I'm pretty confident that we wrote it that you would have to have those on hand at the time that we were obligating the funds, but I will, when we would be putting the contractual documents in place, but we will make sure that that is the correct answer and put it out in our frequently asked question document.
Yeah. All right, we'll come back to some questions. If we go to the next slide, we do have a couple questions here that we've been getting frequently about eligible entities, so I did want to share that quickly. We'll see if we can get back to our slides. Chad addressed these, and yep, this is good. All right, Chad addressed some of these in the Q&A that he had just gone over. So after questions about rural areas and which areas qualify and MHI for service area, what qualifies, the next question we're often asked is whether certain facilities are eligible. And as we mentioned earlier, an applicant for the program must be a public body, a nonprofit, or a federally recognized tribe. The entity must also be engaged in healthcare services or providing healthcare services or in providing nutritional assistance. So it doesn't mean that it has to be solely focused on healthcare or nutrition. Similar to this, we also hear what types of facilities can apply for lost revenue. The lost revenue must be specific to the healthcare services, that service revenue that was lost. But again, the entity that's requesting those lost healthcare services, they don't have to be solely or primarily focused on healthcare services. So we've heard cases where, for instance, a transitional housing type facility had to close temporarily or stop admitting new residents. And the facility could potentially request lost healthcare revenue for the healthcare specific services like behavioral or primary care services that they would typically provide. On the next slide, we want to talk about food banks and food purchases. So we're asked, to what extent can food banks apply for funding to cover food purchases? And like all of the eligible use of funds categories, the request must relate to the pandemic and must not have been covered through other federal or state funding. Food banks, food pantries, food distribution facilities, they have broad flexibility to request funds for facilities, equipment, and operating expenses. Scott, if you could go to the next slide. These can include requests for increased food expenses, increased transportation expenses, additional refrigerator or freezer equipment. Applicants just need to justify the amount requested by comparing what their typical expenses are in a given year compared to what demand has actually been. As you know, because of COVID, demand has increased. So we're interested in how has the number of recipients increased this year compared to previous years to justify those increased expenses. So that's just a highlight of some of the questions that we will address in the frequently asked questions. So now we're going to move on to the Track 2 grants. While the Track 1 grants are meant to be more short-term and provide immediate relief for COVID-related expenses, and in many ways are very similar to the regular CF grant program, the Track 2 grants are very different. Here under the Track 2 grants, we're looking for projects that advance ideas and solutions to solve large-scale regional healthcare problems. The eligible applicants are the same as the Track 1 grants, public bodies, nonprofits, and federally recognized tribes. But these applicants have an added requirement to establish a network or consortium of entities to support the work towards solving that particular regional healthcare problem that the application, seeks to address. It can be a new consortium, or it can certainly be a consortium that's already in place. As for the consortium, it must consist of at least 3 or more entities. They can be rural or urban, just so long as at least 2/3 of the consortium members are in a rural area and primarily serve a rural area. We do require that one applicant be the lead entity and the primary applicant. This will be the entity to receive the award, and it must be an eligible entity type to receive the award. So it has to be a public body, a nonprofit, or a tribe. The lead applicant does not necessarily need to be located in a rural area. The lead applicant for Track 2 only could be located in an urban area as long as at least 2/3 of the consortium members are in an eligible rural area and primarily serve a rural area. So if you have a consortium with 3 members and the lead applicant is a nonprofit located in an urban area, that would be okay as long as the other 2 consortium members are in an eligible rural area and primarily serve a rural area. For Track 2, the same rural area and cost sharing requirements apply. So that graduated scale, the maximum percentage of grant that we can provide, is the same, whether it's Track 1 or Track 2, that applies here as well. All right, now we can move on to the next slide for the Track 2 use of funds. Under the Track 2 grants, we're looking for projects, again, with a consortium of entities that are working together to solve a particular healthcare problem that's occurring in their region. And applicants will be tasked and are able to use the funds to help identify a problem, set up a plan to tackle the problem, implement the plan, and provide an evaluation model to evaluate down the road whether that plan or that project was successful. And the use of funds here are very broad. Applicants that are selected for these Track 2 awards, they'll also be tasked with helping to disseminate lessons learned on their project with the broader rural healthcare community. So we're really looking for some ideas and projects here that we can help share with the healthcare community across the country to potentially replicate in other areas with similar needs. We're also allowing applicants to use grant funds to cover the cost of technical assistance for one or more aspects of the project. We've been asked whether applicants can request funds to help support their data collection efforts, and that might be an example of some technical assistance needs that are needed for the project. So that could potentially be covered under the grant. Under the Track 2 awards, we can also cover indirect costs, and applicants can make sub-awards to other members of the consortium and pay professional service charges when necessary for the project. So these are the use of funds. Imagine we'll have a lot of questions here around this topic, but these are meant to be quite broad to help organizations, consortiums address particular problems that you might be experiencing in your region. And if we go to the next slide, as we were preparing for this program, designing the program, there were a number of significant healthcare problems that we heard raised again and again as issues impacting access to and availability of rural healthcare. So we're certainly not requiring, but encouraging applicants to think about these particular problems, or just provide these as examples of the types of regional healthcare problems that we might see addressed in an application. And I did want to point out just a couple of them. The first one, development of integrated healthcare models. That refers to integrating behavioral health care with other primary or specialty care together, blending the two. And the next one, reducing facility bypass. That means getting rural residents to stay with local hospitals rather than immediately going to the more suburban and urban hospitals. So through this process, as we identify successful models for tackling particular healthcare problems, as I mentioned, we're going to be interested in how we can share and raise awareness so that other regions can consider replicating. And we're going to be we've been working with HHS on how they can help support us with those efforts as well. So if we go to the next slide, we'll show you how we intend to review the review criteria we'll be using. So again, Chad mentioned this, if you think you're interested in applying for a Track 2 impact grant, you will be applying to the Rural Development State Office, where the lead applicant entity is headquartered. These are the review criteria here on the screen that we're going to consider when reviewing and rating Track 2 applications. The first 4 are based on objective criteria that are explained in the NOFA as well as in the Track 2 application guide. And the bottom 4 review criteria, these are subjective ratings. And here we're going to rely on a panel of internal and external reviewers to help us evaluate and score applications according to these 4 areas. And I want to be mindful of the time, but also want to provide you with a quick overview of what these 4 subjective criteria include, and encourage you to look at the application guides and NOFAs too about each of these review criteria as you're putting together your application. So let's go to the next slide. First, our panel of reviewers are going to look at a project's demonstrated need, methodology, and innovation. We're looking at how the applicant identified the healthcare need that they're seeking to improve, and what the expected outcomes and aims of the project are. And we're also going to look at the extent to which an applicant is describing an innovative strategy to address the needs and goals, and the extent that the project will provide demonstrable impact to the community. In the next category, for organizational capacity and strength of the consortium, we're going to be looking at the roles and responsibilities of each member of the consortium. So what does each partner bring to the project? We're going to look at how the project ties in the expertise of each consortium member with the responsibilities that those members have in the project. How will those consortium members be working together? And we're also going to look at the relationship that the consortium has with the particular rural service population for the project proposed. On the next slide, we are going to look at the work plan and the budget proposed for the project to determine whether it's reasonable in light of the project's goals and results. And finally, our review panels are going to look at the proposed framework for evaluation, impact, and ability to replicate. So this includes looking at the data collection efforts and the appropriateness and strength of those efforts, as well as the proposed process for evaluation to measure the impact of the Track 2 project. This category, it also includes the extent to which the project can continue after this program and after the federal funding ends, and the extent to which the applicant and the consortium can disseminate lessons learned to encourage replication. So again, our review panels are comprised of internal and external reviewers. If you have interest, if you have interest in helping us review these types of applications and you don't intend to apply for the program itself, then you can send us an email expressing interest, and that's something we're going to be looking to put together in the next month or so. All right, so next slide, we can pause for some questions. And then we have just a couple more slides to wrap up this afternoon.
Okay.
Chad, how do we do?
Yep. I was trying to mark them for conversation. We'll start off with, can matching funds be received through local, state, or county offices? So yes, you could use matching funds. I don't think we call them cost share, but the additional funds going into a project that are not USDA funds could come from both local, state, county sources. Next, if we have a mobile clinic that serves rural areas, do we qualify? If your organization is located in a rural area and you've got a mobile van or truck that is going to leave that rural area and go across the county and then come back and be stored in that rural area, then yes, that mobile clinic would be an potential eligible expense under Track 1 if you can show how it is COVID related. Are tribal organizations as well as tribes eligible for the Emergency Rural Health Care Grant Program? Yes, so tribal entities as well as the federally recognized tribe itself would be eligible applicants. So understanding that my population is 20,000 or less, then my project could potentially only be eligible for 15% of the project for grant funding. So yes, there are tiers for eligible percentage of grant, and as the population goes up, an applicant is eligible for less grant. So if you're near that 20,000 in population, you probably fall in that 15% tier. Next question. Can we apply for both tracks? We are a very underserved rural area with less than 4,000 people in the town. Does applying for both tracks decrease the chance of getting the grant? So yes, an applicant can apply for both tracks, and no, if you apply for both tracks, it does not impact the scoring for either track. Our county manages the emergency medical services and owns a hospital, but the hospital is managed separately. Would it be best to submit the grant together or separately? So it's asking if the hospital should be the grantee or the county should be the grantee or the applicant. So there's no preference built in for public body versus nonprofit versus maybe the hospital authority. I think it makes no specific difference to USDA as far as the scoring. Just want to make sure that whatever entity applies is the one managing that healthcare service that you're applying for. Does public transit apply? Nope, I don't think public transit system would be eligible under Track 1 because it typically does not provide healthcare services. And And under track 2, maybe it could be a part of a track 2 application as some sort of consortium is solving a rural healthcare problem as far as making services available for a rural resident who would not be able to drive themselves to a healthcare facility. Somehow as part of a regional consortium, maybe that could be an eligible type consortium member. What do you think, Jamie?
Yeah, I agree. That could potentially work for transporting patients. I know that was a major challenge that we heard about in our discussions for this.
Yep. With the expansion of a critical access hospital emergency room in a rural community of less than 5,000, with median household income below 60% level, be better off applying for track 1 or track 2 for this project. Track 1 is supposed to be for immediate recovery or to develop surge capacity with relationship to the COVID-19 pandemic or future pandemic. Whereas track 2 is supposed to look at a large regional healthcare problem and then set together a model that can be replicated in other rural areas in solving that large regional healthcare problem. So to the extent that the critical access hospital emergency room is related to, that need is related to the COVID-19 pandemic or developing surge capacity for future pandemics, I think it would probably be better off in the track 1 process.
Mm-hmm.
We are a nonprofit hospital in a town of 23,000, but we serve surrounding communities with populations that are considered rural. Are we eligible to apply? You would not be eligible to apply for track 1 grants. You have to be located in an eligible rural area. Under track 2, a more urban hospital, if it's a nonprofit or public body, would be able to participate as a consortium member and potentially be the lead applicant of that consortium. Would a school located within a qualifying district be eligible given that they have medical staff providing medical service and or provide food? To the extent that the project is, say, renovating the nurse's office inside the school, there's a provision of medical service being provided in that nurse's office, and there's going to be a renovation of that office so that the student patients can be separated from each other. I think there's a potential for that school to qualify. To the extent that a school provided food that was above and beyond their normal cafeteria service. I know that some rural school systems were used to package meals that were provided across their rural communities. So if there are expenses for provision of meals due to the pandemic that are beyond their normal cafeteria services, then yes, that would be a potential eligible expense as well. If we are a tribe located within 3 miles of the nearest town, we have a population of 2,800, can we include them in our application as our tribal membership is not large? Or do we just apply on behalf of the tribe? So I think it depends upon the service territory of that healthcare facility. So that healthcare facility has a defined service territory. If that town is included inside that healthcare facility service territory, then absolutely you would be able to include it as part of the application.
All right, Chad, I want to go through and finish these last couple of slides now. We're just about out of time. So on the next slide, our website, if you go to the respective pages for track 1 and track 2 on our website, you can find more information to help guide you in your application development. So this is a snapshot of one of the resources available on the Track 1 webpage. So on both of the Track 1 and Track 2 pages, you can find links to help reach out to your Rural Development State Office to discuss your application. So if you think that you might be eligible for the program and you're interested, you want to submit an application, reach out to your state office to begin having those, to start having conversations about the application. At the bottom of the Track 1 and Track 2 web pages, we also have some supplementary materials to assist you. We have an application guide and an application checklist, and these will help you to gather all the information that's required and to submit a complete application. The next slide, similarly for Track 2, on the Track 2 page, we have an application guide and a checklist for the Track 2 applications. I thought that the frequently asked questions at the first tranche of those would go up here while we were talking, and they may have, and I just didn't, just haven't seen that, haven't looked at the website. So those will be going up here today, and then I'm hoping by the end of the week we'll start to add more from our webinar last week, as well as unanswered questions from today. So if we didn't get to your question, we hope that you'll come back over the next several days as we provide more information. If we go to the next slide, we have our general email box. You can also send questions to communityfacilities@usda.gov. And we are also monitoring that email box and trying to get responses back or connect you with your state office as quickly as possible. Chad, was there anything else that you wanted to share here before we end?
I'm going to squeeze in one last question. I had a really good one. If a school district or a healthcare entity is applying for this grant, can it pay for staff for future vaccine clinics, for future testing and equipment, for renovations to expand the nursing offices, for future vaccine and testing events, for transportation of equipment to COVID vaccine or testing events, for PPE supplies? The answer is yes. So appreciate everyone joining us today. We've got hundreds of questions that have come in. We've got a lot of work in front of us. Responding to those, we'll get tranches of those questions up on the website as soon as we can. Appreciate everyone's interested in this, and I'm excited about this opportunity to serve rural America. Thank you for taking the time to join us today.
All right, thank you very much. Have a great day.